So thank you very much. It's a tremendous pleasure to be here. What a great title for a symposium, Nourishing Southeast Asia's Future. And what I'd like to do is show you some of the evidence that for tomorrow's children, that involves engaging today's teenagers. And it's important to consider why work with adolescents. They're a challenging group, as we've heard, but it's a key developmental stage, and they're very plastic during those teenage years, and it affects their current health, their nutrition and lifestyle. There's the potential to affect sustained behaviour change, affecting health in later life. Many lifestyle behaviours are adopted during teenage years. And there's the potential to affect the health of future generations. Today's adolescents, they're tomorrow's parents, and preparation for parenthood is something that teenagers actually want, but they don't receive. And these thoughts underlie the concept of a triple dividend from intervention in adolescence. And our program here has been developing over an 11-year period, and we've been compelled to go down this direction through considering childhood obesity. And the epidemic that has hit the developed world is now, of course, happening in Southeast Asia. And it's something where there are important exposures, which are not just postnatal or during pregnancy, but they seem to operate pre-conception. And there's a variety of memory mechanisms. Epigenetics is another talk we heard about in the introduction, which I could give, but there are memory mechanisms through which these early life experiences alter the risk of later adiposity and obesity in childhood. Some of the data that underpins this comes from our SWS study, Southampton Women's Survey in Europe, and from the Gusto cohort in Singapore that I'm involved with. But suffice to say that when there are a number of these perinatal exposures, the risks of childhood obesity are substantial. For example, in the Gusto study, more than 10-fold increased risk if there is an aggregation of a number of these risk factors, and these particularly include maternal obesity. In the UK, we are not winning the war on childhood obesity through tackling interventions like sugar tax, school meals, physical activity in childhood. We are not winning the war. If you look at the top of these lines, it is the trend from national data from our public health body, Public Health England, over the most recent 10 years. And in the less advantaged populations, there is an inexorable rise in childhood obesity. And if you look at the vertical axis, it is scary. This is 20 to 25% or greater. And sadly, I believe that Southeast Asia is heading precisely in this direction unless we adopt fundamental measures to tackle it. And one of the fundamental drivers of this epidemic of childhood obesity appears to be maternal obesity. And this is data from a recent large European cohort or group of cohorts just published this year, where across the range of maternal body mass index, higher mother's BMI associated with higher child's BMI, particularly in later ages. And this is not genetics that underlies this. You can measure all the genetic risk variants, and they do not underlie these trends. So are these childhood exposures associated with maternal BMI? Are they pregnancy exposures? And the increasing evidence is that they are pre- and periconceptual mother's exposures. And we aggregated together some of the evidence that underpins this in both experimental and animal studies published in The Lancet last year. And it's not just mother, it's father's obesity from the experimental data, now starting to be seen in humans, understanding that mother's obesity, mother's undernutrition, assisted reproductive technologies, they all have lasting effects on the offspring through a variety of mechanisms, particularly including epigenetics. This is the sort of life course model that we've been understanding these exposures within. And central within this is becoming now the child and adolescent. They are an effective point to change the risk trajectory for the next generation. So what about adolescent health behaviours? There are challenges with diet, there are challenges with physical activity, and there are challenges with engagement. And public health has traditionally adopted a rather poor model of trying to work with schools, where public health interventions have been applied to schools rather than with schools. And that's a very important distinction. In certainly our setting, teachers are vastly overworked. The curriculum doesn't allow these public health interventions to simply come in. And we've been developing this program, which we call LifeLab, over an 11-year period. And I'll try to give you some sense of how we've developed something which we think has a chance of being effective. And the central concept here is around science and health literacy for better health in teenagers. To make the health promotion concepts culturally relevant, part of the child's environment. The children themselves, we find, often become agents of change within the family. They go home and say, I'm not going to eat those sugary drinks anymore. Mum, don't buy those. I need to go to the gym, get me a subscription, and let's do it as a family. And it's not so much about reading a health text, which kids do excessively, but it's on science self-discovery, promoting the science, health, and nutrition literacy. So this program, Me, My Health, and My Children's Health, is an educational intervention based on research. Over 9,000, actually close to 10,000 students have now been through it. And it's tailored for all abilities. And not, I hope, from YouTube, but from the local PC. I wanted to give you a sense of what this is about.
Welcome to LifeLab. We're based up at Southampton General Hospital. Here you will get to find out about your own health using a range of different scientific equipment, investigate DNA, meet scientists, and discover how you can reduce your own future health risks. We look forward to welcoming you to LifeLab soon.
Hi, today we have used the ultrasound machine, which is to check our arteries. Today has been really fun because we get to find out loads of facts about our bodies, which is really interesting.
Hi, today we are at LifeLab, and in this session we are learning how to carry out CPR properly. This is important because if we ever put in an emergency situation, we will be able to carry it out properly and help the person.
Hi, we're at LifeLab today, and we're going to see 3 scientists behind these doors, and they're going to talk to us about how they use science in their work. enjoyed learning about the other scientists. It's so unexpected that you find this in a hospital or places, because you expect loads of people being treated, but there's actually lots of researchers going on behind the scenes as well. In this session we got to dress up like real scientists and study our own DNA. It was a lot of fun.
I think Life Lab is a really good learning opportunity for other students to take things out of the classroom and try things that we can't give you in school. This morning the students got an opportunity to try a range of activities, doing body measurements, all sorts of equipment and kit we just don't have access to. I think every single one of them I know I've spoken to has thoroughly enjoyed that activity they did this morning, and I would encourage everybody else to come and try it.
The best time of the day was definitely the experiments, as they got us all involved using all the new equipment that we'd never used before instead of just telling us what to do. I think other students should attend Life Lab because it's such a great day and it's such a great experience that you're probably never going to get unless you take up this role, and it really helps you decide whether you want to do something like this or not.
So the problem is that teenagers know about nutrition, about science, but they don't think it's relevant to them. And the program is designed to help them see that relevance to their own lives, but also to the lives of their future families. And we've been doing a series of research activities to evaluate and refine and develop the methods. We showed lasting effects on the attitudes and the beliefs of the teenagers, and we're starting to show changes in their health-related behaviours. We've been doing this as a series of cluster randomised trials, hands-on science. In the UK, this has been health and safety, as I call it, out of school. It's too dangerous for them to be involved with, and the teachers have been de-skilled, and we seek to fix that. They learn how they can improve their own health and the health of their future children. And they become enthusiastic about science, considering further scientific disciplines. It's got a number of components, of which professional development for teachers is a really key part. So doing it with the schools rather than to the schools. We've developed the modules so the teachers love us because they don't have to develop the curricula themselves. And we're developing a primary school version of it alongside the hands-on Life Lab for teenagers. What's become clear is that the teenagers want to make pledges about changing their diet. In the blue column, they wanted to make pledges about changing their exercise, their sleep, and other health-related behaviours, but they need supports in relation to that. So we've recently received substantial funding to develop electronic support tools, gaming-type tools, apps to support those pledges that they make when they come to our facility within a new trial called ENeA. Part of this is about the teenagers themselves, but part of it is this preparation for parenthood. When during teenage years, they are actually thinking more than others might imagine about preparation for parenthood. Making progress here requires understanding adolescent values, and there are multiple, often conflicting values. I do want to be healthy, but this is my life, and I will do what others do, and peer pressures are important, but they do want to be healthy and to fit it into their life, and it's only through understanding these values that you can make effective interventions. So what do teenagers value? Of course, being with their friends, doing things they're good at, but very importantly, being seen as individuals and being respected and supported. And I think today's societies do that very badly. There's deep psychological theories which underpin the work that we're doing around autonomy, competence, and relatedness. And it's only by embedding these within programs that really you will get an effective program to engage and change behaviours with teenagers. So at first sight this is complex, and it is, but it requires a whole understanding of the theoretical basis if you're going to move things forwards. So my final slide to conclude. If we're really going to engage teenagers and change preconception, nutrition, lifestyle for the health of the next generation, we do need to understand the motivations, the values and life goals which change as the teenagers get older. And we have to have person-centered interventions. They focus on autonomy, self-discovery, building capacity, but social interactions are a critical part of that, and hence our utilisation of gaming theory approaches. Thank you very much.
Thank you, Mr. Godfrey. Any questions for Mr. Godfrey?